Why you may find it difficult to get pregnant, part 2. If you've been trying to get pregnant, or you're a lady, you're not even trying to get pregnant, this video concerns you. As long as you're a woman, it also concerns the men, because you will learn the things that will prevent you from getting your wife pregnant, okay, and how to prevent them. Please listen attentively. If you're trying to conceive and it's been too hard, I'm going to give you about 12 things that is making it difficult for you to get pregnant, and you have to look out for them. Number 1, if you've not been ovulating. Most people are not aware that they are not ovulating. I'm going to, on my next video, I will tell you how to know that you're not ovulating. Meanwhile, I already have a video here on my YouTube page that explains the signs of ovulation. So I think you will watch that video. It will help you know if you've been ovulating or not. But expect a video from me on how to know that you're not ovulating. I also have a video on how to bring back your ovulation, okay? Now, that is number 1, if you're not ovulation. Number 2, some hormonal changes in women. A condition called polycystic ovarian syndrome. This is treatable, okay? It is manageable. If you have PCOS, you can get pregnant. Yes, you can get pregnant. This PCOS causes imbalance of hormones in the woman. It causes insulin resistance, okay? It makes it so hard for a woman to get pregnant, where the ovary has so many cysts, okay, that it makes the woman now produce immature eggs, okay? So just locate, most women have polycystic ovarian syndrome and they are not aware, especially the young ones, okay, that are growing. It is rampant now. Locate the video on polycystic ovarian syndrome here on my YouTube page too. There are 2 videos actually, the one I did with a gynecologist and the one I did by myself. So watch those 2 videos. You will learn a lot, and also how to get pregnant with PCOS and how to manage it. Now, the next thing is too much prolactin. This is in the case of those people that are not pregnant, okay, or it's been long, you gave birth, probably 2 years, you stopped breastfeeding and breast milk is still coming out from your breast. This is a typical sign of high prolactin. I'm going to talk about that on my next video too. So if you're still seeing breast discharge, it will, as you're not breastfeeding, this indicates there are still other things that can cause this. Indicates that your prolactin level may be high and it will impede you from getting pregnant, okay? And the solution of this is seeing a gynecologist, have a hormonal profile test run. A drug usually called cabergoline or some other kind of drug will be given to you to bring back your hormonal, and I'll make a video on that too. So having discharge high prolactin can make you not to get pregnant, okay? Now, the next one is ovarian insufficiency. This can also make you not to get pregnant. Yeah, it's usually hormonal, it's usually genetic sometimes, okay, where your immune system makes your ovary for you not to ovulate, okay. This can make you hard for you to get pregnant. The next one is hypothalamic dysfunction, which can also be seen, I'll explain, in the case of hormonal imbalance. Now listen, there are 2 hormones that are responsible for a woman ovulating. One is luteinizing hormone and follicle stimulating hormone. Adding so much weight, losing so much weight, emotional stress, physical stress. This is in the case of men that are subjecting their wife to stress of any kind emotionally, telling her she can't get pregnant. And this is where anxiety comes in as a woman trying to get pregnant. I keep telling you people, calm down, have sex and enjoy sex. Of course, keeping in track the time that your ovulation window, okay? Please, these hormones now, when you are all of these things that I mentioned, stressed and all, you gain so much weight, your body mass index is high, or you lost weight drastically, it can alter these hormones, okay? And you will find it difficult to get pregnant. Remove anxiety. Be careful, just remove anxiety, okay? The next one is damage to your fallopian tubes. This can be caused by pelvic inflammatory disease that is left untreated can cause scarring in your fallopian tubes. It prevents sperm, from swimming in or, to go and fertilize the egg. So damage of your fallopian tube through any kind of infection, PID, gonorrhea, can make you have infertility issues. And also fertility issues, I beg your pardon, and also blocked fallopian tube. Of course, it's blocked. How will the sperm go through? So I'll make a video on all of these things. Okay, this channel is basically, I opened this channel basically for my dialysis patients, but unfortunately I have a lot of women trying to conceive, so I'm trying my best, consulting with doctors and gynecologists, and by God's grace I'm majoring in this aspect too in my PhD, so that I can help women more. So can having fallopian tube scarring and blocked fallopian tubes can impede your fertility. Okay, the next one is cervical problems. For instance, now fibroid can develop and block any part of the reproductive organ of a woman where sperm can pass through, okay, or where the egg will attach. This will make it hard to get pregnant, and also cause there may be cervical stenosis where your cervix is closed. Sperm can't pass through. So this is why it is very important that if you're having any fertility issues, you have to see a gynecologist who will run tests, check your body system, check your reproductive organ to find out if everything, your reproductive health is okay, your hormones are okay, your husband is okay. If everything is okay, now we can now start. Okay, so but if it's not, they will now consider what is going on. Okay, they will now consider what is going on that is making it hard for you to get pregnant. Please be aware of this. Now, another one in the aspect of cervical issues, okay, can be your vagina, being so acidic. Your cervix is not producing the amount of the what is it called again? The good cervical fluid. It can be too acidic. Okay, it can be too acidic where the sperm can enter and die so fast. The sperm won't even survive up to that place. Okay, so knowing all of these things, this is why I tell you, don't stop asking, what will I take? Can tell you a lot of things to take, but it's just to get money. Find the cause. What is going on? You have to go on a consultation, okay, with a fertility doctor. Okay, for now, I am not licensed. I'm not trained for that. By the time I get my training, I will help you better. Now, the next one is unexplained infertility. By the time everything has been checked, some people, it is just there, unexplained. There is no cause. Okay, of course, remember in all of this thing I'm saying, there is nothing God cannot do. He will give you your child. Just believe on him and keep praying. Okay, so the next thing I'm going to be telling you now is the risk factors. There are risk factors. These are not things that are going to cause, but this can increase your chances of not getting pregnant. Number one, smoking. Smoking does not only cause miscarriage or an ectopic pregnancy, even damage to your unborn child. In case that child, if the child survives, it has a lot of neurological disorder the child will face. So smoking can prevent you from getting pregnant. It can, sag your breast. It can do a lot of harm, even to your partner. It can make your partner have low sperm count, produce low quality sperm. So if you're trying to get pregnant, your husband should stop smoking. Please be very certain that smoking does not mean that you only smoke. There are different kinds of smoke, vaping, tobacco, and all of those things, and inhaling them. Secondary smokers, these are called secondary smokers. As long as you are inhaling smoke from other people, you are smoking. Please be aware that you're smoking if you're inhaling smoke from other people. Okay, so be aware of this and stay away from clubs where people smoke or beer parlor where people smoke, so you don't inhale it. Next one is alcohol. Cut off alcohol if you're trying to get pregnant. This may impede you on getting pregnant, and if you get pregnant, your baby may be affected. So the next one is excess weight gain or losing weight drastically. If you have high body mass index, it will impede you, just like I said earlier, from getting pregnant. So you need to try to lose some weight, work out, do exercises, work out, so that it will reduce the male hormone androgens, and know the kind of food you're eating. High complex carbohydrates, starch like bread, what are the likes? Shawarma. What are the likes? I hardly eat this food. Rice, it's just eat a lot of vegetable. Ice cream, processed foods, all those noodles, all those starchy food that are high complex carbohydrates, sugar, added sugar, beverages, they are not good for you. It will make you it fits on polycystic ovary. If it fits on your androgen level, the male hormone to grow more than the female hormone. Okay, so it makes you add so much weight and it's not good. So you have to cut down on this thing. In fact, when you cut down, for those having issues with their ovulation, you see your ovulation come back naturally. Take vegetables, cucumbers, do green smoothies. Your period will come back, your ovulation will come back. Please try to lose weight, work out, do exercise. Don't mind anybody telling you that if you're trying to get pregnant, you should not do exercise. No, in fact, it's easier to take in when you are working out. Okay, so try to also, not to lose so much weight. If you're underweight, it will affect you also. Okay, eat healthy. Now, in the case of the man, please, your husband is very important. Most men are having low sperm counts. They're having sperm issues and they're not even aware. Probably because they felt they've impregnated a younger when they were much younger. But now, as you get old, your sperm quality reduces. That's a fact. Don't judge because you gave birth to you pregnanted somebody when you were younger, that of course you're okay. You both should go to see a doctor who will run tests, check everything if everything is okay. If everything is okay in the side of the man, then we'll know what to do. So a man can have sperm issues, fertility issues too, as well, not only the lady. So as you're treating yourself, your husband should also do all of these things that you're doing. Okay, so please make sure you locate the video for your husband on how to causes of low sperm count. For some women having sperm leakage, I have a video too here. And okay, the videos are the same, watery sperm and low sperm counts, the causes, and then you'll see a video on how to treat low sperm count. Watch that video. So please, I hope this is understandable enough. Please find out, go to a gynecologist, find out what is going on with you. Remove anxiety, reduce stress, be calm as possible to, of course, welcome your baby. Check yourself. If everything is okay, then you can now go to and please, you have to also know that if you've been trying to get pregnant, it's not that you just got married 1, 2 months, 3 months and you're worried. It has to be up to 1 year. If it's up to 1 year, like you're 30 years, but if you're like from 35 downwards, if it's up to 6 months, that's when you should go to see a doctor. Okay, locate some other videos. I have other videos where I talk about you have to be having sex on your ovulation, ovulation day. Just watch those videos. I hope this video has helped you. On my next video, I'll be talking about how I've promised you 3 videos now. The next one, I'll be talking about how to food that increases your chances of getting pregnant. Please like, share, and subscribe. My name is Unexplained.